Hello again. This is the CDH Dad and
the CDH Warrior.
welcome back to another Mondays on Mondays. For those of you that may have been following through, we try and do this once a week. We do it on Mondays, and we happen to have the last name of Monday, which is how we came up with the name for this. But the focus of what we want to do is to provide a forum to discuss some of the issues related to families that have children with special needs, some health issues that impact their interaction in their early and development years, and the experiences that we have. We have a disclaimer, which is we are not medical professionals, we're not psychologists, sociologists, we're not therapists. We don't have those types of backgrounds. But from the experience that we have in our family, 2 children. My son was born with congenital diaphragmatic hernia, CDH, which was birth defect in case that the diaphragm was not fully formed and the organs from the abdomen ended up in the chest, and a lot of issues there. And part of the reason we deal with this is that we're still involved with the improvements in the activities with this, and we're seeing the success rates that the communication on that involves. When he was born, it was a 30 to 50% chance of survival. Now it's about an 80 to 90% chance of survival in general. So we're wanting to work towards those items, but it's also a matter of how does the family live and survive with that. The second part of that is I have a daughter who had no birth defects, no issues there, but at the age of 2 developed aplastic anemia, which basically means that her bone marrow shut down and her body was not able to form red blood cells, white blood cells, platelets, the basic needs for life, and ended up having to have a bone marrow stem cell transplant. And that involves chemotherapy, radiation, and a lot of those type of things. So as a family, we've had a lot of experience in how to deal with helping your children grow, develop, nurture them in their toddler, adolescence, elementary, tweens, teens, and in this case, into their 20s. So this forum is just kind of to help other families that are in similar type situations, because we see a lot of this on social media, families that are suddenly thrust into this type of situation, and what do I do now, and then what can I expect on down the road? So that's part of what we're doing. So with that,
let's roll the title.
Okay, welcome back again to Mondays on Mondays. Last week we talked about a new program that is in place, a model that they call the pyramid model, which was just recently put together by a group of universities and government officials working together on how to improve early childhood intervention programs and how to work as a cohesive group in terms of teachers, families, healthcare professionals, etc., in terms of how to help a child develop and engage and reach equity in their developmental process. So today what I want to do is just kind of expound on what we discussed last week in the discussion, and kind of I'll throw in some bits and pieces of this, and I know we talked about it, and you can probably put a couple of little slides in the presentation so that people can see some of the things that we're going to be talking about in the slides that were presented, so that you can see some of the depictions. But to start with, there are federal laws that emphasize the importance of family engagement and the early childhood and childhood development process. I think everyone's familiar with the Head Start Act, which started a long time back.
Decades ago.
Yes. There's also the Child Care Development Block Grant, Maternal, Infant, and Child Health Home Visiting Program, Public Health, Title V, the ADA, the Americans with Disability Act, which came into play. And I'll expound on that in a little bit. One that I was not familiar with, Individuals with Disabilities Education Act.
I was vaguely familiar with that one, but
Okay.
I'd heard of it at random. It's relatively new.
Right.
Within the last probably 5 years. But it's been a really had a really major effect on the education as well as the school systems.
Right, and I think this is part of what we're talking about is it's difficult to take all children and put them into a special education class because not everyone falls into the same categories.
Mm-hmm.
You and I were just talking yesterday about, the differences between sensory integration disorder and auditory processing disorder, but they both now fall under the same DSM guidelines. And my son has actually, he actually ordered and has received the latest pediatric DSM
the latest
books.
pediatric textbooks that they're using in med schools.
And the one he had previously, which was, from maybe 15 years ago.
Longer than that.
Longer than that, 20.
That was about 25 to 30 years ago.
25 to 30 years ago was a large textbook about this thick.
Now there's two of them.
Now that same size, it's two. So,
Yeah. And we've gotten to a point. Sorry, I didn't mean to cut you
No, go
off.
ahead. Go ahead.
But a good portion of the second volume of that book is on the psychological issues that can happen later on.
Right.
As a result of these different health issues.
Right. But anyway, we've got the Every Student Succeeds Act, which is another one I'm not familiar with. It's fairly recent, but it's laws that the federal government has passed to help improve the capability for education for all children, and to get it to where it's more individualized. There's also one, it's the U.S. Office of Special Education Programs, which is a group that I think has just recently been developed within the Department of Education. And
most of the stuff has really been developed within the past 10 years. So it's not even one of, when I was in school, these things existed. Very little of this existed when I was in school, and that was 12 years ago.
Right, hasn't really been that long ago, but I know from our personal experience, it was difficult to work with the school systems and the professionals there and help them, try to get them to understand that, children that have had a medical issue that has delayed some of the development steps need some special assistance, but it's not the same special assistance as those that have chronic lifetime conditions such as CP or autism and those things.
Yeah.
So you've got to work on trying to put together an individual program that fits the needs of that child. But the OSEP, the Office of Special Education Programs, works with families from infants, toddlers, children, and youth with disabilities from birth to the age of 26.
Yeah.
So they've expanded this to a reasonable time period because this goes through the whole process of, your nursery schools, your kindergartens, your elementary schools, your middle schools, your high schools, and then into the college age, but then also the transition from childhood into adulthood, and how do you make that step from there?
Well, and I've discussed this occasionally, that the transition from the school into the workplace as well.
Right.
Because that's part of what hits when you're late 20s, mid to late 20s, where basically between 18 and 26, that's what they're trying to do, is they're trying to ease that transition from either high school to college, or high school to the workplace, or college to the workplace.
Right. And one of the gaps is still in place is because these are involved in the Department of Education and within those areas. So it's more on schools and dealing with people with disabilities. But then it's also a matter of how do you work with the employers and the workforce and those type issues.
Yeah.
So it's still, there's still room for growth there. And then the other part of this OSEP is partnering with professionals and policymakers to improve the outcomes for all children with disabilities. So that we're looking at trying to make this all-encompassing in terms of what programs, what philosophies are in place, and how we can get this to work for the betterment that we have the opportunity to help all people be able to achieve success.
Yeah.
And we were just talking prior to this, and it's something that my son doesn't remember, but we were fortunate in the fact that we were in Florida and then also in Georgia, but we were close to people who were involved in early childhood intervention. We got to know those people quite well, some that we had known in various ways, but after his birth, when he came home and was needing therapy, it was occupational therapy, physical therapy, and also speech therapy, more for oral aversion and eating disorders that come on particularly in CDH children. But the program was housed in the United Cerebral Palsy Center.
Yeah.
And it wasn't necessarily just for cerebral palsy. The therapists were based there and worked with a number of children with a lot of different spina bifida, autism, CDH, a lot of those things that came into play. But I just wanted to bring about an incident that he doesn't remember, but they were doing a telethon, and we did a couple of segments during the weekend telethon. And one of the members of the board of directors was a gentleman with CP, had gone on to be successful. He was an architect, but he was there during the telethon and went to the restroom. And full ADA was not fully in place. The restroom was not handicap accessible. He went to the restroom, but then he couldn't get out. So he took his cell phone and called the pledge line and got someone on the booth answering the phone to let them know that he was stuck in the bathroom in his wheelchair. So, that was 28 or 27 years ago.
Yeah.
Probably in that time period. So hopefully we've seen some improvements in that we're getting better equity in the capabilities in these things. But there's still a lot of room for improvement over the time. Part of what this program that we're talking about, the pyramid model that's being developed and implemented, is family engagement in the early years and the early grades, and then putting that into practice and in development into helping your child achieve the best possible outcome.
Yeah.
Families are the most important in sustaining the effects of child's learning, development, and wellness.
Yeah.
And I'm kind of reading off some of the bullet points here. The activities such as reading and talking with your child, interacting with your child at home is critical to the development of that child, whether they're with disabilities or not with disabilities. And it's more difficult if you have a child that has some type of a disability, is trying to figure out how do you interact with that child? How can you best deal with that child and helping to nurture and develop them. Promote enriching learning activities in the classroom and then carry those over into the home that can contribute to the learning and development of your child. The family is well-being as a strong predictor of a child's school readiness, and promoting the family's strength and resilience through the comprehensive services and practices, such as a two-generation approach to support young children. Yeah. And this is one where we've mentioned in the past is it's critical if you're a family that has a child with a medical disability or some type of disability, is to involve the entire family, not just the parents and the children, but the grandparents, the aunts and uncles, anyone else that's available out there to help support in that child's development.
Yeah.
Then positive relationships between the families and the providers to reinforce learning at home and in the community, and enable a two-way communication, cultural, linguistic responsiveness. And some of what we've seen in our experiences is, it's the family, it's the school, but it's also the community interactions.
Yeah.
And part of this is various programs that are out there. The scouting program is trying to help the scouting program learn that they need to include and develop programs that can help include children with disabilities and problems like that. Mm-hmm. It's also one, my daughter was in dance, and one of the programs in dance was they had a special class for children with disabilities so that they could help to interact with that. A lot of things like that are very useful. In my daughter's case, it was one, after having to go through the stem cell transplant and all that was involved there, we had a 2-year-old who was no longer able to walk and couldn't move effectively. So we needed the therapy once we brought her home. Part of what we involved her in was got her involved in dance, because dance was really probably one of her best therapy programs, because it helped her in many aspects of development. So these are the things that are really critical to try and help your child get into the normal childhood activities and developments.
And I want to touch on a point you made. Sorry. So the way we view progression and development is that it's linear, that it goes forward or back.
Right.
It doesn't. And we see so much of the occasional backwards that we start getting mad at the fact. The first thing we do is we get mad at the parents or the child, but we don't consider how the progress actually looks as an overall.
Right. And kind of tying into that, and we did talk about this, and my son's going to try and get this into the into the presentation, but we're looking at the difference between equality and equity. And if you see in this example, it's like different individuals with different things, a youth, an adult female, male, a child that's in a wheelchair, but they're all in the same, trying to ride the same bicycle. And that doesn't work. They can't all fit equally that way.
As I use the pigeonhole example, is that equality, they want everyone to fit in the same spot.
Right.
Equity acknowledges the differences and tries to work to help them.
Right. And this is where we've kind of discussed ourselves in what is considered normal.
Yeah.
And if you really look at normal,
you're only looking
in
at
a normal
5% of the population.
A normal distribution is basically 66%.
Yeah.
Is the standard bell curve that we look at.
Yeah.
And that's 1/3 above and 1/3 below what's considered the median and the midline. But as you said, that midline is only a small segment.
Yeah.
And either way you look at it, you're either to the one side or the other of that normal. Yeah. And then it's a matter of, well, how far away are you from normal? And then once you get to a point, then you're considered abnormal.
Yeah.
And that's what we've got to get away from, is that, you know, we all have our own abnormalities. We all have our own differences.
Yeah.
So how do we work to integrate that into a development and into a community and into a society that we can all accept one another and help each other develop to our best possibilities?
Yeah.
The pyramid, and it's a small chart, so I can't really print this up, but we'll try and get this included in the presentation. But it's looking at, you know, your standard graphic pyramid, but at the base is having an effective workforce.
Yeah.
That means we need to have effective early intervention specialists. We need to have teachers that are able to understand that. We need to have community persons that are able to do that. Yeah.
I was going to see if I could actually...
I'll have to blow this
Okay.
up so we can get that in there. But I'll hit just the high points. But then from that, then you need to have a nurturing and responsive relationships. So then it's a matter of the parents, the family, working with the early intervention, working with the teachers, working with the community, working with even their governmental politicians, etc.,
Yeah.
in what is necessary in this case. Then we work towards a high quality supportive environment to be able to help people develop and learn as they need to with that equity available. Then we work towards targeted social emotional supports.
Yeah.
And this is part of the thing in particular when we get into the school systems, is you need to develop individual educational plans with your school system. You need to make sure that the doctors, the nurses, the therapists, the early interventionists, the teachers, all people are involved in what needs to be in place to get there.
Yeah.
And it also needs to be the back and forth. And it's not, well, we do things at home and then we do things at school. It needs to be the lifestyle that home and school interact with one another.
Yeah.
And we make sure that that fits into the physical capabilities and medical capabilities of that child.
Yeah.
And then at the very peak of this is there the need for intensive intervention? And there are some children that are going to need more intensive care in this.
Yeah.
I know I've seen children that had an individual aide that worked just with that child in the classroom to help them as was needed. That's not necessarily required in all cases, but we need to tailor those available resources to the individual child and their capabilities.
Yeah. And
So-
that's part of what IEPs are starting to do now, although I'll be honest, the school systems are still fighting IEPs.
It's,
IEPs and 504s are still being fought by the school system.
It is, and it's going to take a while to make that transition and get to that point. As I said, when the gentleman got stuck in the bathroom, ADA was in place,
Yeah.
but it was not fully capable at that point. Now, in many cases, we have a lot of these resources available. There's still some gaps, but it's much better than it used to be. But it's taken several decades to get to that point. And it's going to take time to get to these points. But this is one that we just wanted to kind of bring up in this discussion, is there are a lot of programs out there. Programs that I'm just learning are out there that were not necessary. have been.
They weren't there.
They weren't there 5-10 years ago.
Yeah.
But they are there. But we need to find what resources are available, how we can tap into those, and what we can utilize to help our children achieve the best possible lifestyle and development that they can.
Yeah.
So with that, I'm pretty much finished with catching up from what we had last week, and hopefully you all will have a great week.
Have a great day. We'll see you next time.